My name is Dr. Ankit Desai. I'm a vitreoretinal surgeon here at Silver Cross, and my practice is located in Plainfield, Illinois. It's called Windy City Retina. So vitreoretinal surgery, basically, it kind of covers every aspect of the eye, typically more of the complex, complicated cases. However, we specialize behind the lens in the back of the eye where when cataract surgery is performed, everything behind the back of the eye is kind of what we specialize in. So there's a body of gel in the eye that occupies the space. And then on the very back surface of the inner lining of the eye is a tissue called the retina, and it behaves like the camera film of the eye, so it allows you to see. Retinal surgery, again, it entails everything behind the back of the eye, although we do have to venture into the front part of the eye to do several things to fix whatever's going on in the eye to make sure we maintain the retinal integrity. But there are several types in the sense of like the diagnoses can vary and the maneuvers within the surgery varies. The main one is called a vitrectomy. We can also perform a scleral buckle, which is a procedure that we perform. We put an implant around the outside part of the eye to distort and change the shape of the eye to reattach the retina. But most of the surgeries performed now are with a vitrectomy, which is intraocular within the eye. The ones that I do most commonly are retinal surgeries involving the central retinal area where there is maybe some scar tissue that's distorting the tissue in the back, which in essence, if you think of like distorted camera film, you're going to also get a distorted image in your vision. So that's a very common procedure I perform. I can remove floaters in the back of the eye if they're visually significant, bothering the patient's vision. And a very emergent one that we perform is for retinal detachments. Most common symptoms for retinal detachment are flashes and new onset of floaters. Typically, you will not have those day to day. You might have your kind of floaters that you kind of see towards the end of the day, or you see one here or there. But if you all of a sudden get like a large new floater in the eye or a shower of bunch of floaters like little gnats or black pepper in the vision, that's very concerning for retinal tear, which can lead to a retinal detachment. But vision loss is a huge part of retinal detachment. That varies. If it depends on the status of the central vision occasionally, in terms of when you should have surgery done. If the central retina has been lifted off or you've had poor vision for some time and we see it and it's been several weeks to months, sometimes we can schedule it within a few weeks. We try to get it done immediately, but depending on other medical conditions, compounding factors, those sometimes take a few weeks. But if your central vision is still intact and you're able to come into the office right away when those symptoms start, we typically want to get you to the operating room within just 24 hours, so even at most a few days. It's variable. For retinal surgery, if it's not involving a retinal detachment, you really don't have to do much of any positioning. I know that's a huge thing patients get worried about when they first come in and hear about retinal surgery. Most of the time, you don't have to do any positioning. When it's retinal detachment surgery, you will be doing some positioning, and it can vary between a few days to maybe a week. Rarely do you ever have to go much longer than a week in terms of face-down positioning, and sometimes we can even get away with side positioning. Preventative measures are basically, if you're very nearsighted, come in for an annual eye exam. If you're over the age of 55, come in for an annual dilated eye exam. If you get a bunch of flashes of light or new floaters, don't sweep them under the rug, because if you put it off and then all of a sudden it keeps on progressing, you come in at the last second, it could lead to something pretty bad. Whereas if you come in with a new onset of symptoms, we see you pretty quickly, and if there's a tear, we can take care of it in the office. That can save it from becoming a detachment.